Next on News Talk, AM 1480 WLEA, The Newsmaker Show with Kevin Doran.
Brian O'Neill in for Kevin Doran again. Last day for that, by the way. Kevin will be back tomorrow. Our guest today is Hornell internist Dr. Spencer Annabelle, who's going to make sense and translate the state Senate's hearing on Obamacare soundbites that we have today. That hearing was held yesterday at the state capitol in Albany. The hearing was chaired by Long Island Republican State Senator Kemp Hannon. This is Senator Hannon talking with the executive director of the State Health Department, Donna Prescottor, about some interesting numbers that came out. And I'd like you to hear this exchange now, Dr. Annabelle, and our listeners.
Since you got into numbers, I just wanted to go through some of the numbers here because I wasn't aware until this morning. You talked about the total number enrolled in an individual coverage in New York is 230,624. And you said 66% of them went into qualified health plans. So that would be 152,211 if my non-common core math works. So that's 152,000 that are going into non-Medicaid. I presume the rest of the individuals, this other 78,000, are going into Medicaid.
Some portion of those numbers are for the people who enrolled by December 24th.
I'm just taking it from your statement.
So there's a portion of those individuals who, I think your math is absolutely correct. Within the 230,624, about 68% of them are individuals who enrolled in qualified health plans, either with or without financial assistance. There's a percentage of those individuals who were children who qualified for CHIP, because the marketplace is likewise enrolling children in the CHIP program, if that's the best option for the family. And then the remainder, about 27% or so, were Medicaid. That's the 61,625. So we have one front door where individuals apply through the marketplace, and then depending on their income, their family composition, if they're eligible for Medicaid, they're enrolled in our state Medicaid program. If their children are eligible for CHIP, they're enrolled in CHIP. And if they're eligible to enroll in a QHP, and whether they get tax credits or cost-sharing credits or not, they're enrolled into a QHP product.
Dr. Annabelle, can you make a little sense out of that for us?
Well, what's happening so far, New York State has elected to take enhanced Medicaid reimbursement from the federal government. That sounds good, but it only lasts for 5 years, where the federal government will be picking up a significantly greater portion of our Medicaid expenses for New York State. Medicaid breaks down into two groups of people. People who are still functional, who qualify for Medicaid, their children, certain income limits. Now, after 5 years, this supplemented Medicaid rate goes away, and New York State will have been encouraged to pick up a number more people, and the federal subsidy for this will be gone, and New York State will have to pick it up. So that's kind of the 5 year, the upside of it. Yes, we'll have more people covered with federal money in 5 years from now. The federal money goes away, and we'll have a larger Medicaid bill than we have now.
Now, in this next soundbite, Senator Hannon goes on to sum up the numbers that he's seen and heard. And here's what he says.
We agree that 152,211 went into qualified health plans, which is non-Medicaid.
That's right.
And then you also later in your statement said half of those never had insurance before. Or, I'm sorry, you said half of those were uninsured.
Half of the individuals were
who
uninsured.
Went into the private plans were uninsured.
That's right.
So we've now offered so far about 70 insurance for people who had previously been uninsured to 76,000 people.
I think that's the correct logic for the math. The percent of people who qualified for Medicaid that were uninsured at the time of application was slightly higher, but that's a separate number.
So my interesting point to you would be this state had CHIP, Family Health Plus, and Healthy New York. And the last time I could find numbers for Healthy New York, we had about 170,000, according to their annual report in 2010. 170,000 were enrolled in Healthy New York. Now, that's individuals and group. But my point and my contrast is that was a significant number of people who had received insurance in this state, and I contrast that with the 76,000 we've just gotten now under the ACA.
The ACA being the Affordable Health Care Act. Dr. Annabelle, what I just heard there, from what I can make out of it, it seems to contradict reports that everything is going perfectly well with Obamacare in New York State that I've heard from the mainstream media. Your reaction to that back and forth between Senator Hannan and Donna Prescott from the State Health Department?
Well, New York State, a number of states, and typically those with Democratic administrations, formed health care exchanges at the invitation of the federal government. New York State is one of those. A number of, say, more conservative or Republican-leaning states refused to participate and form the health care exchanges. That being said, any state like New York with a health care exchange program already operational, when Obamacare started enrolling people, was able to get probably quite a few more people in than other states that didn't want anything to do with it. The numbers, it's hard to say what they mean. I mean, they're claiming, of course, they've got 78,000 people who are newly insured. Hard to say what that means, and clearly New York State's enrolling significantly more because they have the exchange program up and running than states that didn't. But it's, in the millions of people in our state, it's still a relatively small number. The other thing I'd like to comment on, under the Affordable Care Act, Obamacare, whatever you want to call it, the federal government is subsidizing health care insurance premiums for people who earn up to 400% of the federal poverty level. I don't have hard numbers what that would be, but and it depends on how big your family is. If you just are a couple, it's lower. If you have more children, and the federal poverty level is higher. But that is subsidizing an incredibly large number of people. Up to 400% of the federal poverty level is at pretty good income, and the federal government's going to be subsidizing all these people at 200%, 300%, 350%, 400%. And
This is State Senator Bill Larkin from Rockland County. A much quicker soundbite here. Wanted to get your take on it, Dr. Annabelle.
I did a survey over this weekend, everybody I was asking. The biggest complaint is I can't have the doctor I want. Out-of-network is not an explained situation.
Now, he's talking about Rockland County. First thing there, Dr. Annabelle, can you explain what the phrase out-of-network means?
For example, I participate in a number of insurance products in Hornell that cover most of the folks that live around here. I don't know, we probably participate in 12 or 15 plans. Now, let's say one of my patients is in the St. James, Hornell, Dr. Annabelle network, where their preferred provider goes somewhere out of town, gets an acute medical emergency or surgical emergency or something, and has to go see a doctor or an emergency room in that place. Or let's say they want to see some very specialized high-fluting specialist that's not in our local system, that may not even be in the Rochester Hospital network. And that person goes out of network to see that person. Their co-pays are staggeringly higher, and they basically make it cost prohibitive to go out of network. That's what that means.
On the topic of Obamacare, I have to say I don't have a dog in this fight. To tell you the truth, I don't go to doctors anywhere nearly as much as I should for checkups. I could go years without one. So from a personal standpoint, this is not affecting my life. I'm not a crusader here. I'm just a bystander on this one. I was under the impression that things were going well with Obamacare in New York State until I heard yesterday's State Senate hearing. This is State Senator Martin Golden, a Brooklyn Republican, in this next clip.
I think we're all a little concerned about the out-of-network issue. And there was an article back in the Times back in October 18th about a young girl that had a heart issue, 9-year-old DeAndrea, Miss DeAndrea. And she went in, the hospital told them that they took their insurance, and they had no idea the number of people that were in the operating room and how many doctors were out of network. And they got additional bills for all of those out-of-network anesthesiologists, out-of-network doctors, and it was pretty overwhelming. So there were two areas here. One, obviously, is when there's an emergency and you're put into an emergency situation and you go into the emergency room and whatever doctors are there obviously are going to work on you. There's also the secondary where you can actually plan to go into a hospital and you can actually take a look at the doctors that are in your network. But we don't have a list of those doctors.
And Dr. Annabelle, she answers that the problems are pretty much taken care of under the current system.
The network's information for each of the plans is available. It's on the website. We've also, since we launched New York State of Health, made a tool available to consumers as they're applying for coverage so that they can enter the name of the physician that they desire, and they can see the affiliations with different health plans. In an emergency situation, all of the plans that are certified on the marketplace, consistent with both federal and I think state rules.
Dr. Annabelle,
Well, it depends on how much you trust what is being said by either party. Obviously, if you remember when Obamacare was being touted, the president said you can keep your physician if you like him. The problem is with that, and many pre-existing insurance contracts got canceled because Obama set a level of quality for the insurance products and comprehensive stuff they had to cover that was much higher than ever before. For example, let's say you're a 50-year-old guy, you're wanting to buy insurance, you're single, and the policy you had, you were happy with it. It's been canceled because it didn't meet Obama's criteria for covering your pregnancy or other stuff that you're never going to have, and you lost your insurance policy. And that insurance policy, say, was for example, was a plan that I participated in. And then what you're going to have to do, and this is a good thing for our patients going forward, one of the things you're going to have to consider when they pick what new plan they're going into is their doctor and their hospital system in that plan. Now, down here, I think it's fairly simple. There are two major players, Exelis, Blue Cross Blue Shield, and I can't quite at the moment remember the other plan. But I would just advise our listeners going forward, be very careful when you look at your plans, see what's covered, try not to buy something you don't need, but make sure who the providers and where the networks land you. A little bit beyond that, when I have a patient, for example, request an orthopedic or a cardiology consult, I have a pretty good idea who I want to send them to, but I say, hey, check your insurance plan, see who your preferred providers are. And that saves them a lot of financial hassle later.
We're talking with Dr. Spencer Annabelle on the Newsmaker Show today. I'm back in just a moment with more on yesterday's state Senate hearing on Obamacare and how it's going in New York State. Back on the Newsmaker Show, I'm Brian O'Neill. Kevin, just getting back from the winter break. He should be back tomorrow. Now, so far in today's show, we've heard audio clips from yesterday's state Senate hearing about Obamacare's rollout in New York State. This next clip is from the state's medical society. This is Dr. Andrew Kleinman.
The problem that we have is that having access to insurance coverage is not exactly the same as having access to health care, and that's where our problems really lie. Basically, what has happened is that with the rollout of this, there have been networks of physicians listed on the websites of the various insurance companies. Now, first of all, it's very hard to find those lists because you can't access it directly from the website of the New York State of Health. You have to go into the individual carriers.
Dr. Spencer Annabelle.
If you are not highly computer literate, you have to have family members help you navigate this nightmare. And it's a time that our older citizens, I don't know what percentage of Medicare recipients, but a good number, have no idea how to navigate this, and hopefully they have a younger family member or someone that can help them navigate this. The other problem is this is supposed to end up insuring 30 million more Americans when it's done, and it's obviously going to take several years if it's even on schedule for that to happen. And you're going to have to try to find care for 30 million more Americans who weren't insured before this law started. There's been no great surge in physicians. Every plan that the doctors belong to are going to want negotiated discounts. And what you're finding, very, very few physicians graduating from medical school today are going into primary care. And they're going into specialty training, and I can't say as I blame them.
We've got two more clips here, Dr. Annabelle. One from Blue Cross Blue Shield attorney Sean Doolin on the effect of Obamacare on individuals and small businesses.
The individual market, which we talked about, which definitely has some promising features. On the flip side, I think you've heard pretty loud and clear, there has not been a lot for small business in the ACA. You have additional benefits. Number one, which obviously lead to the increased cost in coverage. You have a very narrow tax credit band that clearly is not providing a sufficient incentive for businesses to participate in the exchange. Likewise, that tax credit under federal law lasts only 2 years. And so you have additional taxes. The ACA tax, the research tax that was enacted last year, the issue about self-financing, which you talked about or touched on earlier, Senator, in terms of paying for the exchange in 2015. And going forward, to me, that is, especially since there is no mandate for the small group market, addressing the affordability of small group coverage will be critical.
Dr. Annabelle.
Well, the good news is for small businesses, you have to have at least 50 employees before it's mandatory to have to provide insurance coverage. And pretty much everybody who is selling insurance, the people who've begun to shop for it and buy insurance, it's going to cost everybody your coverage next year, in the year we're now in, I guess it's already this year, is going to cost more than it did last year. And any company that has to provide insurance is going to require their employees to pay an ever larger portion of this insurance. I mean, if you think of the math, you're going to provide medical care for 30 million more people. And everybody who's getting medical insurance is going to have to pay more for the product they already had for the system to work. It's that simple. And if we don't sign up all these young, healthy people who were all the arithmetic was based on, the cost will be even greater for those that do sign up.
Now, some in the mainstream media in New York State have been singing the praises of the New York State website for the insurance exchange. Senator Kemp Hannon, who chaired yesterday's hearing, was not so positive about it.
So 3 times I put in the search for Navigator. The first two...
Not the search function. It says when you're on the home page, it says get help. Do you see that?
But there's a search function. What would you do with a search function?
Well,
ignore it?
I think you're supposed
to. The third time I pushed Navigator, it does show you someplace there's site locations for New York State Health, and it also got me to the DEC Navigator.
Okay,
and it got me to the New York City Department of Health and Mental Hygiene.
But can you just go back to the home page? If you go to the home page, and it says individuals and families. You click on that, and then it says get help.
I do websites a lot.
Okay.
I buy a lot of things.
Uh-huh.
It's not a great website.
Dr. Annabelle.
Well, it's two people arguing about the same website. One's trying to say it's great, the other say it's not so great. And, I've never looked at the website, so I have no personal opinion. But again, unless you use computers a lot, you're on web pages a lot, you're going to need younger family members to help you.
Dr. Spencer Annabelle has been our guest today. I'm Brian O'Neill, filling in for Kevin Doran once again. We've been talking about yesterday's state Senate hearing on Obamacare that was held by the Health Committee and the Insurance Committee in the New York State Senate. Dr. Spencer Annabelle, thanks very much for joining us.
You're welcome, Brian.
Thanks for listening. Kevin Doran is back tomorrow. It's AM 1480 WLEA Hornell. WLEA Hornell. WLEA Hornell.